As you can see, we need to plug in the ultrasound machine. They designed these outlets down here on the floor. 3-prong. It shows the patient you're very committed to their treatment. You care about them. There we go. Of course, start by washing my hands. See the ABCs, make sure we get all the germs off. Alright, good morning, Danny. My name is Dylan. I'm a student physical therapist. I'll be working with you today. So I know you have an injury on your thigh, so we're going to be using an ultrasound machine, okay, to apply some heat to that. It's going to help the blood flow in the area, get some circulation in there, and help with the pain. Does that sound good?
Sounds fantastic.
Awesome. All right. Before we get started, I just need to ask you a couple questions. Do you have a history of any cancer in the area at all?
No, sir.
Any metal in the area, any plates, screws, nothing like that?
No, sir.
Any blood clotting issues in the area?
Not that I know of.
Awesome, man. I'm just going to ask, are you pregnant?
No.
Okay, good. So that all seems normal. So I'm going to inspect the skin. I don't see any open wounds on the area. I'm just going to check your sensations, so I'm going to give you some light touches on the thigh. If you feel it, just tell me yes, okay? All right.
Yeah. Yeah. Oh, yeah. Oh, yeah.
All right, sensation seems intact. I'm just going to check the blood flow into the area as well. Do a blanch test for capillary refill. Everything seems good. All right, so I'm going to apply an alcohol swab to the area to clean any impurities that there may be. You know, maybe he's been rolling around in the dirt outside. We don't want anything getting in the way.
I'm clean, boy.
So we're going to apply our conductive gel onto the leg. Just a little bit in this area here. And then while we're setting up the ultrasound machine, we're going to have the head of the ultrasound device on the area, and it's going to be moving while we're actually pressing the buttons in the area. All right, so the machine will turn on as soon as it's plugged in, so all we need to do is press ultrasound here, and then we're going to select manual operation to set the parameters ourselves. Since we want to use this ultrasound for application of heat, we're going to leave this set as continuous, and you don't need to worry about this button here. We want to use a frequency of 1 that allows us to get deeper into the tissue with the heat, although it can be set to 3, but we're going to leave it at 1. The units here need to be set at watts per centimeter squared. You can change it to watts, but we want to leave it here. And then as soon as I press this with my finger, the ultrasound will start sending the waves into the tissue, so we want to make sure that the head is on the tissue and moving around when we select that. Since the frequency is low, we're going to set the intensity a little bit higher. I'm going to set it at 2 for this. So we just select it and turn the dial up to 2 here. And we want to be using small overlapping circles on the area that we want to apply the heat to. Danny, you should be feeling some warmth in a couple minutes, but it should not feel like it's burning you. Okay, if it's uncomfortable at all, just let me know. We want to make sure that the head is never stationary on one area, as this can lead to a burn of the patient. And as you can see, I have a towel tucked into his shorts so that the gel does not get onto his shorts. Yeah, he wears Lululemon, so we obviously don't want to ruin that. You know, that'd be expensive on your part. How are you feeling, Dave?
I feel like it's healing.
It's already looking better. You know, this is a magical machine. It really does work. So we're gonna go for about 5 to 10 minutes. And then when I remove the head of the ultrasound, I have my towel here to wipe it off. I'm gonna wipe the gel off of the area and inspect the area. I don't see any burns in the area. I'm just going to check the sensation really quickly. You feel that?
Yeah.
Good.
Yeah.
And then check the blood flow into the area. Looks normal.
Thanks, Doc.
No problem, my guy. If we want to use the ultrasound machine for tissue healing purposes, we're going to again select ultrasound and manual operation to set the parameters. Again, we leave this button here alone, and instead of continuous, we want to change it to pulsed. We're going to select the duty cycle at 20%. Remember, this is the amount of time that the machine is sending waves into the tissue versus the time that it's not. The frequency is up to you whether you want it to be superficial or deep. If we wanted to go more superficial this time, we would set it to 3 megahertz, and the units are going to be the same as well. So we'd use this for Tissue healing, if we want to get that cavitation and that microstreaming among the cells, this is going to be more superficial, and then it's going to be a pulsed time. So since we have the higher frequency, I'm going to set this intensity lower, around 0.5, and then we would do it for the same amount of time.
Thanks to Dylan's ultrasound, I can now squat without pain.
Ultrasound, it really works.